The coronavirus outbreak has brought significant changes to all of our lives. And whilst many of us try to look after our physical health, our mental well-being is more important than ever. A new listening line telephone service has been set up for those struggling to adjust to our new and very unusual way of life. Joining us from Wakefield is Harris Iqbal, Chief Executive of the Penny Appeal. Hello to you. Thank you very much indeed for joining us, Harris. Tell us about the line.
Thank you. Good morning. Thank you for having me. The listening line was launched in response to COVID-19, and it's there as a support service to provide assistance to those who may be suffering with the disruption this has caused in their daily routines. In the current lockdown and otherwise those who are self-isolating, both issues that can lead to difficulties and stress. And what we're seeing is an increase in anxiety, in panic, in fear. And the listening line is really there to provide support for those who are struggling with those intrusive thoughts or those who may not necessarily have someone to speak to. I think, these are unprecedented circumstances. These are challenging times for many of us. And pre-COVID-19 agencies like ourselves have been supporting vulnerable groups. And, loneliness is something that's been reported as a silent killer, particularly in older communities. And so the support line and the listening line is really there to provide a safe space, a confidential space, an outlet for people to be able to speak to practitioners who are able to help them with coping mechanisms and strategies to deal with the challenges on an individual basis.
How has COVID-19 changed the sort of calls that you're receiving, Harris?
Well, I think they range from a diverse group of challenges, so to say. So, the service is open to people from age 18 plus, and so people present with different challenges. So, others, some may be talking about challenges with employment, others who are struggling with staying indoors, some who are concerned about childcare facilities, and so on and so forth. So all of them present with different cases and different narratives. But what's important is to make sure that people have qualified support available to them in their challenges and difficulties as they deal with the circumstances of COVID-19.
Yeah. Are you able to offer any medical advice, or is it more a listening service?
No, so this is a listening service, and it's there to provide, like I say, a safe space, a confidential space that's able to signpost to other agencies and make sure that people have access to services that are appropriate to them. But in principle, this is a listening line that's there to support people with coping mechanisms for their own individual needs.
Yeah, and I'm guessing, Harris, though, you can stretch that to offering practical help in suggesting who they need to talk to if they do need help with their groceries or whatever that might be.
Absolutely, and the team have proactively been engaging in those conversations, and so we've been working very closely with statutory, voluntary and faith sector organisations to make sure that we have relevant information to provide signposting services to those who are calling in. We are providing national coverage, and so that presents its own complexities, but the team are doing everything they possibly can to make sure we're able to signpost people to the right places.
Great work that you're doing. A virtual hug for you. Thank you very much indeed.
Thank you.